young and they are eager to know a lot of things. Okay. I worked with this field for the last few years with my friend who met you 2 days back, Dr. Mankura. And it's a very fascinating field in Delhi. Also, it's a field of bread and butter for every doctor. Okay. According to statistics, of every 6 patients walking in your clinic, one of them would have some complaints related to extremities and back and all that. Okay. It's our bread and butter. The very nice part of rheumatology is that it is one field where any doctor in the world has to follow the basic homeopathic concept. Okay. There is not a single case except injuries, in outbreaks. But the rest of the rheumatology field, most of the cases, there is a lot of contribution of what's happening to the person's life and what suffering is having. Okay. Whether you take autoimmune condition or even the other conditions which are all taken as a part of rheumatology. So I selected few cases of that kind where you can see these and where our scope is immense. Most of these cases end up with very incomplete treatment with other sciences. So in that sense, there is a lot of advantage we have. And it's one field through which you can expand practice very fast because half of them are limping or they are having a very visible complaint. So that also gives you a big advantage that you work on them, through them people know your caliber faster. Okay. It's like making not only patient feel good, but also people around feel not good. Because when a patient of rheumatoid is going through troubles, he is not just himself suffering. There's a whole lot of people around who are suffering. And this whole process you can take care by involving in the physician. So this is a very big job satisfying area from our practice angle. It's also an area which tests you out. How many of the concepts can you put together and apply? It's not like that you take a short history and you have some quick solution fix. It's something where you need to work really thoroughly with everything. And you are reminded of your basics, you're reminded of what you read, you're made to study again. All these things are there in this area. So it kind of promises you a lot of growth if you take interest. And there will not be anybody who will get rheumatic case. Okay? It's not that something so rare. As soon as you settle in practice to some degree, you start getting simpler conditions and you start getting more tougher conditions. Because practice, as I always tell my students, it's like, they ask me how soon should we start practice and how long does it take. Okay? So my answer is that it depends upon the power of the magnet to draw the follicles, iron follicles around. How much you charge yourself with capacity to solve problems. To that degree, problems will come to you. Don't think that you take many years to start practice, it will give you advantage. Don't think you start too early and you will overcome the waiting period very soon. There is nothing like that. Okay? It all depends on how you meet your first patient, what that patient feels about you. That is going to decide how soon the second and the 10th one is going to come to your clinic. It's the whole feel that you give to a person, and that will then depend upon obviously how much is the experiential impact that the patient carried from you when he went from you. So with this, that's the title that I put to the whole approach, fusion. Okay. You all have heard of fusion. It's something like integration, but a little more. So you require an approach study for these kind of conditions where everything you are going to put into one. We all read a lot, but all that reading must go into one so that you can really give some holistic care. And you must realize that all our popularity and all our reputation, the homeopathy as a field is built up because of results we have been able to give in these cases which require holistic care. Homeopathy has not become famous for treating injuries or arnica so much. As much as like in rheumatoid field, there are WHO panel reports where homeopathy is mentioned to be the best and promising alternative medicine. Sometimes your patient might come and tell you, my allopathic rheumatologist says that don't take anything else. You could quote to them, okay, that there are official agencies which have studied cases and they reported success rates. So they should also be talking fanatically. Okay, and there are times when you can work together. There are times that you can take independent charge. No? We have right from people from Kent's time. There are cases on rheumatoid to the new authors. Okay, everywhere you can find these cases to study, and what you only have to know is that whatever is happening in the modern scientific field about diagnostic, about treatment methods, because there are always a lot of things good things which happen in any science. And if you are a scientific mind, you would know what will work well with your medicines and how you can combine for best, kind of care of the patient. There are things which are compatible, things which are not compatible. And this is one thing which we learned from our sir. You met a lot of our group people now recently. Dr. Davle represented a spirit which made us to feel, don't just study homeopathy, study everything which will make you practice homeopathy better. Okay, so that was the whole theme with which we studied under him. And I think right now the difficulties I see in my juniors or students is that there are a lot of things available. Okay, 21 years back when we started with close, the situation was like this, that there were many people to teach, practice. People wouldn't like you to sit in the clinic and show you the result. People won't explain you what is happening. Now there is the other extreme after 20 years. There are a lot of people who want to explain you a lot of things. And that gives you so many schools of thought also. It's like this thought, this way of thinking, you heard about ICR, you heard about other authors. So you need basically a frame of mind where you have some clear basics and where you can put all these things together. So it's like different religions. Okay? For a person fanatically involved in one religion, that religion is great. But if you are just a simple educated mind which is trying to look at everything, you would not find it difficult to say that all religions ultimately teach the same thing. They try to teach humanity to everyone, they try to teach good behavior, they try to teach how you can overcome your negative experiences and remain positive and do good for yourself, do good for others, and the world will be a better place to live. It's something similar in homeopathy also. All different schools of thought, they are different at some part of the levels. They all believe in the same core level, and you can integrate almost everything. In fact, if you see even when you study repertory, you study about Ken, Boger, Monigosen. At some level, they all are very different. Ken spoke completely of mind, Monigosen completely of physical generals, and Boger completely of pathological generals. Okay. But can you say that all three of them are so different that you can't practice them together? It's not learned. So it's something similar about current approaches also that you hear about. Okay. Actually, the teacher should not decide what approach you should follow. Okay. You should also decide what approach you should follow. Fine. It's the kind of case which you should decide how you will select your approach. Keep this in mind and you will find that you can integrate all of them. So we are trying to do something like that today. The word fusion represents these. It's a union or a bonding, okay, together as one whole, okay, of different stimuli. You try to make all this into one unitary experience, and this becomes a continuous process, becomes a continuously stimulating process. And if you do it well, it gives a lot of energy to you. Okay? I'm sure if you try to practice with something similar, you always find energetic at the end of the day. You will not feel go home tired. No? You will go with some interest. And I'll share with you some cases in which I felt those moments happening. Okay? So you need to do this into a working system. Study everybody, listen to everyone. See, it's like in every house, there is a hall, there is a dining hall, there is a showcase. Okay? Every house also has a wardrobe for old clothes, and every house also has a toilet and an unclean area. Okay? When your guests come, what do you show them? You try to see that they remain in the hall, and they should appreciate what collection you got in your showcase, or how is your presentation of that room. Okay? I think that's what happens with all of our approaches. Okay? We all showcase what we do very nicely. Don't think we only do things nicely. Okay? There's one single homeopath in the world who is 100% result oriented, has 100% result. I got 100%, I don't think it's even 50% for most of us. Okay? Somebody like Kent has written that it is very, very rare that we find similarium. Okay? He's written lesser writing. It's very rare.